Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Hello friends, welcome to a new lecture today. Now I would like to discuss about one more surgery, which is incision and drainage. For which surgery do we do incision and drainage? What is the indication? The indication is presence of pyogenic abscess. Remember, presence of pyogenic abscess is the indication for incision and drainage. What is the contraindication? Contraindication is presence of cold abscess or tubercular abscess. In such cases, you should not do incision and drainage. How are you going to place the position of the patient? He can be in supine position or prone position or lateral position depending upon the site of the abscess. Here in anesthesia, you can give either a local anesthesia or general anesthesia can be preferred. If the abscess is multiloculated, then we give general anesthesia. Normally we can do on local anesthesia. Okay, now preparation of the patient, you'll have to drape the patient, and then the abscess, that abscess part should be cleaned. The abscess and the surrounding skin, it should be cleaned with bethadine. It should be painted with bethadine, iodine. Then procedure. In the procedure, first you will have to give an incision. Mostly it is a pyogenic abscess, so an incision is given, which is called as Hilton's incision. The incision which is given here is called as Hilton's incision. Now you give a Hilton's incision, and then you will give it over the most prominent part of the swelling, and then you will you will drain the pus and then send the pus for culture and sensitivity. And then a sinus forceps or finger is introduced into the abscess cavity, and all the loculi are broken. You will introduce a sinus forceps. Sinus forceps is introduced into the abscess cavity, and you will break all the loculi. And then during that time, if fresh blood oozes out, then that will show that the procedure is complete. Then the cavity, after that you will irrigate the cavity with antibiotics. You will irrigate this cavity with antibiotics. Okay, if this cavity is very large, then you will pack this cavity with a roller gauze, which is soaked in iodine. You will, if the cavity is large, you will just pack it with roller gauze which is soaked in iodine, and then removed after 24 to 48 hours. How are you going to close it? An abscess, if it is an abscess, it should not be closed because there is a chance that it contains bacteria and pus. So we don't close the abscess. In post-operative management, you will do an antibiotics, or control of diabetes should be done. Then what are the complications? The complications are the vessels which are underneath. Vessels which are present underneath the abscess, they can injure, leading to formation of hematoma. That is one. Sometimes it can cause injury to vessels and nerves during the drainage of abscess also. And one more thing, there is a chance of infection of the abscess. So this method of drainage is called as Hilton's method of drainage. Thank you guys for watching my lecture. Thank you.
thank you and thank you for watching.